Ebola, or the Ebola virus, is a viral disease. The first outbreak of Ebola occurred in South Sudan in the Democratic Republic of the Congo in 1976. The second outbreak, which is likely what you will remember about this virus, occurred in 2014 and was the largest. The mechanism by which Ebola infects starts when the virus attached to a host cell and releases its viral RNA. That viral RNA is then transcribed into mRNA and made into proteins and tRNA. The tRNA is then used to make new negative viral RNA, which is packaged with viral proteins, and then the virus buds, meaning it exits the host cell and continues to infect in this mechanism. The onset of Ebola virus can range from 2 to 21 days, but averages around 8 to 10. The symptoms at onset include fever, fatigue, muscle pain, headaches, sore throat, vomiting, diarrhea, rash, and can lead to impaired kidney and liver function and internal and external bleeding. Ebola kills around 50% of the people it infects. Ebola has not, as of yet, been used on any population because it is incredibly hard and dangerous to work with. Its life outside of a host cell is only a few hours, which makes experimentation hard for scientists. Because of this, it has not been weaponized and has no actual method of dispersion. The Japanese cult Aum Shinrikyo did, however, attempt to obtain the Ebola virus as part of its biological warfare program, but was unsuccessful. Ebola, though it has not been harnessed as a bioweapon, is transmitted by humans and non-human primates through direct contact with body fluids and infected fruits and bats. No specific treatment has been approved for Ebola, but there has been some breakthrough. As of May 2017, there was a possible cure discovered using the antibodies of mice, but it was only effective against Ebola zaire and has not been fully tested. Ebola, because of this, is typically treated by hospital care and rehydration. If Ebola were to be turned into a bioweapon, it would be under the anti-personnel classification, meaning it would be used against people on the other side of a conflict. Protective measures when dealing with Ebola include washing your hands, staying away from any contact with the virus, practicing that correct sterilization measures, and wearing protective equipment. Destroying Ebola is in theory easy because it cannot survive long outside of a host cell, especially when radiation is at play. However, the destruction has to be controlled because of how dangerous the virus can be.